Thank you all so very much for being here again and making the time, especially after a long work day. We have a pretty jam-packed agenda filled for you guys today, but we'll get started with introductions here. My name is Jose Serrano, COO here at United Way, and I'm joined by my incredible team that they'll get a chance to introduce themselves here shortly. Thank you all for your commitment, not just to yourselves to go through some professional development, but your commitment to your organization. This program, and our CEO will kind of let you know a little bit more about how this program came to be. We're very thankful for our partners at the City of Stockton for seeing the vision of this program years ago. And we are going into year 4 of the nonprofit capacity building program, which is pretty incredible here. So before we get started, I do want to share a video from our graduation last year, and also share a few words from former city manager Harry Black. So give me 1 second while I get this started here for you guys.
It's great to come up with an idea and to be able to work with other people to turn it into a reality. In the nonprofit capacity building program through the United Way of San Joaquin County, it's just that. The pandemic required an all hands on deck approach to getting through it. Every level, every segment of the community had to be involved in the problem solving, the strategy, and the execution of the strategy. We were able to rely greatly on our nonprofit community to help us out in terms of serving as an extension of city government, in terms of providing services to the public. But we also realized that there were a lot of gaps from one nonprofit to another in terms of their capabilities and capacity to fulfill their missions. And so I was able to persuade Kristen to take this, grab it, knowing that the city was going to be right there with her as a partner to do something that's different, but that's going to have a major impact on these organizations, which means that they can have a greater impact on how they can support and help the city of Stockton.
If you're looking for something as a way to train your staff, to give them some skills, to get them critically thinking and do it very close to home in a very affordable manner, this is the way to go.
It provides a framework that really walks you through step by step how to improve your nonprofit, and it helps you give a holistic view of the holes that you have and the ways that you can fill those holes in a systematic process.
It has influenced the way that I approach my work and my leadership style, because I'm always thinking now about, is this sustainable? Is it something that's going to carry us into the future? Does it match our mission? Does it match our goals? It's really put me in a goal-centered and oriented way of thought.
The stronger our nonprofit community is, the stronger the city of Stockton can be.
Awesome. As you guys can see, what a powerful program. And again, a big time shout out to the city of Stockton for really stepping up to the plate and seeing the vision and what this program could accomplish. And not only that, but what we have accomplished in the last couple of years. So without further ado, I want to have the opportunity to get you guys to meet the wonderful people who actually make this program go. And these folks are committed individuals who bring a wealth of knowledge to the program and who are committed to making sure that our area nonprofits have the tools that they need in order to do some good work in the community. So we'll get started off with none other than Kristen Birtwistle, President and CEO. Kristen, feel free to say a few words, and then we'll popcorn over to some other folks.
Sounds great. Sounds great. Thank you, Jose, very much. And welcome everyone that's on the call today. It's very, very excited to see your faces, to even through a Zoom call, sort of sense the anticipation for this next upcoming cohort class, your senior year number, class number 4. But I, as the president and CEO here of United Way, one of the things that was really critical, I think, to myself and to our board, was recognizing that the capacity of our nonprofits in many, many ways historically has not been strong. Ironically, we have over 2,000 nonprofits here in San Joaquin County. That employs over 21,000 people, both part and full-time, and generates close to $1 billion annually back into our county coffers, if you will. So nonprofits are strong, they are essential, but over 71% of those nonprofits here in San Joaquin County have budgets of $50,000 or less. So we really do have sort of a gap in terms of the fiscal strength of our nonprofits. But what we wanted to do was really design a program for this 9-month window. And you'll hear all about the curriculum today from our esteemed colleagues here that are really lead the charge in instruction, human-centered learning, et cetera. But I think this year's program is going to be uniquely exciting because I feel like we have had 3 years worth of really trying to understand and best define how can we work with our nonprofits? How do we make sure that, again, you have the money to meet your mission? How do we work with your boards? Because I think the pairing between the board and the CEO is absolutely pivotal. But all I can say is if you do, again, apply, if you are selected, this is a phenomenal program. The team that you would have wrapping their arms around you for a full 9 months is unique and different. This is not a professional development workshop. I always like to say, this is a life-changing experience and an opportunity for you to take, again, your nonprofit to the next level. But do expect, and you'll hear the requirements from, I call it, now I'm calling him the Hammer, Jose and Kim Tucker, about what really, what this means for you personally in terms of dedicating your time and your talent to make, again, yourself a better leader within San Joaquin County and within Stockton. So anyway, I just want to thank you for all being on the call today and for trusting United Way as a convener and a capacity builder. So can't wait to meet you. So thank you for being here. With that, I'll turn this over to Nikki. No, Jose, you tell me who to turn.
Let's go. Nikki, you call Nikki, you're up.
Okay.
All right. Hello, everyone. My name is Nikki Lowry, and I'm the founder of Lowry Consulting and Facilitation. I have been working on this project since its inception, really, coming alongside Kristen, United Way, as an outside consultant, conducting even the very first focus groups of assessing the needs within San Joaquin County leadership and what the gaps are that we as this team for the nonprofit capacity building could address. And so my role is to assist Kim in instruction here and there with some human-centered design aspects and reflection, but also data collection and analysis of program effectiveness, and also to conduct office hours on a weekly basis with those who are interested and willing. So I have about 20 years of nonprofit work experience within San Joaquin County. And so I bring that understanding and insight to this program, but then also a lot of experience with HR and operations as well. So something that both Kristen and Jose said, we're a very well-rounded team, and we're very excited to work, equip, and bring up the leaders who are a part of this program. And we're all very excited for the launch of year 4. I'll hand it off to Kim.
Hey, everybody. It's good to have you on the call. I hope that you'll follow through and apply for the program. I don't know of any other program in this area that's like this. And I think the success that previous cohort members have had speak volumes of the value that it brings to your organization and hopefully to you personally and professionally. And you'll hear more about what's involved in it as we move along. But I'm just really pleased to be a part of this team. Nikki says we're well-rounded. I think we're a little crazy, but that's okay. I think that we make for a really good team, and we'll get you through this, right? And I think if you're serious about building the capacity of your organization and your team's ability to do the things you need to do in a really rough environment for nonprofits, then you're going to want to be a part of this program. So thank you. It's good to meet you, sort of.
Awesome. Thank you, Kim. And then one of the newest members of not only our United Way team, but you'll get a chance to hear a little bit more about her role within the program. I'd like to bring over Cristina Bastida.
Hi, thank you. Good evening, everyone. I'm Christina, the Director of Community Health. I've had the pleasure of connecting with a lot of nonprofits in our area, especially those that are client-facing and render, health or social health services. I look forward to sharing more about the Medi-Cal track, a very specialized curriculum that we have prepared for folks in the new year. We're really excited leveraging our esteemed partnerships with Health Plan of San Joaquin and Public Health Services and others. Just a quick note about my background. I am trained in public health with a specialty in infectious disease epidemiology. So, being really responsive to what our community nonprofits have been sharing around what it is they need support as they participate or explore participation in the Medi-Cal space. We're really excited to bring that forward and make sure that we support you along the way and alleviate as much of the administrative burden that you are undertaking as possible by focusing on that Medi-Cal administrative capacity building. Thank you.
Excellent. Cristina, thank you so much for sharing that. We really appreciate it. And it's only right, you've heard, you've had the opportunity to hear from the team, but I'd like to actually turn it back to Kristen to kind of really give you an idea of how this program again came to be. And we do have Lana Lozano, who is from the city of Stockton, and she's joining us on the call as well. So she'll also chime in. But Kristen, can you kind of give the group as to how this partnership got started really quickly, just so folks understand the importance of the program?
Sure, absolutely. And Lana could probably sort of add on to that. But it really started conceptually again during COVID. And during that period of time, there was a clear recognition by the city of Stockton that we did not have nonprofits, as many as that we would like, to have really helped set up emergency situations or use of funds that were coming into the community to distribute those through rental assistance or around sheltering or housing. And so the city itself was having some real challenges with the nonprofit community because they didn't have a high degree of confidence in the skill and ability for, again, us to, I think, perform at a high level in terms of supporting the masses of individuals that were being impacted by COVID. So as a result of that, Harry Black and myself, the former city manager, we had this vision that what if we established a highly intensive training program specifically for our nonprofit community here with the intentionality of raising their ability, again, to sustain and grow the size and the scope of the work that they do, to bring more money and revenue in through grants funding and other donor funding opportunities. And so we just started to build a curriculum with others in mind. And as Nikki mentioned, we sat down and we met with nonprofits across San Joaquin County to really get an understanding of, okay, what is most important to them if they want to be around for the next 5 to 10 years or longer. I mean, United Way, we turn 100 years old here in another year. And we've got longstanding organizations, but even the longstanding organizations were having some internal professional challenges to meet the demand of what was happening in our growing community. So essentially, I would just like to say there was something really amazing. There was this this huge snowball that just hit us and said, this is what we need to do. But the reality is we saw a need and we really decided with the city of Stockton as a partner and a very blessed, wonderful, engaging partner the city has been with Lana and Harry Black and the whole economic development team. Without them, we could not have done this. So I'm thankful. So that's sort of the genesis of everyone of where we are. And here we are 4 years later, which kind of blowing my mind. That is 4 years. It seems like the conversation to say, hey, let's get it done happened like last week. So yeah, that's my story and I'm sticking to it, everyone. So there you go. Lana, do you want to add to that?
I thank you for having me, Lana Lozano, City of Stockton Economic Development. I couldn't have been more concise about that history. I think Kristen hit everything on the head. I would just like to echo the sentiment that as much as United Way needed us, we needed them. We couldn't ask for a better partner, as well as all the team that has been brought in from Kim to Nikki, Jose, Liz, and the list goes on, everybody else at the United Way organization. We appreciate your partnership. and everything that you're doing with the nonprofit community. The city cannot do this by itself. We absolutely need our nonprofits. And so probably now more than ever. And over the next 4 years, you guys, we're going to need you even more. So please participate in this class. We believe in it. We know it works. We are seeing the impacts from it. And anything that the city can do, economic development can do, we are open ears. We are listening. And we're here to be partners for the duration. So thank you guys.
Lana, we really appreciate it. Well, now there you guys have it. I think we could probably end the call now, and you guys are going to be excited to just apply and be part of this program. So, but let's actually get into, the weeds here with the program has to offer. I'm going to jump into the program overview, and I'm actually going to turn this over to Nikki and Kim to kind of tag team this piece and really just talk about the curriculum and why these 4 pillars were chosen as a foundation for the program. So they can give you insight as to what the expectation is and what you'll learn. Kim?
Yeah, thank you. You see those 4 pillars there on the left under curriculum. Brand and community engagement, they're pretty straightforward titles, but what we're talking about there is your ability and your team's ability, including your board of directors' ability to introduce your organization in the community, to attract community partners, and to responsibly manage the brand of your organization. So it's a wonderful opportunity not only to get to know your cohort members, but we kick it off with that so that we really are drilling down on what is your key message in the community and that value proposition that you bring. Operational framework, not an exciting topic, people, but if you don't have one, you probably can't fulfill the things you've been funded to do. So we're going to talk about data and, how you manage your resources prudently and how you report on those and how you collect that information to share with funders. I think you'll get a lot out of it because it'll show some very practical gaps in your organization, most likely. The revenue structure, I mean, more money's more mission, right, people? So, we have to be concerned with where we're getting those dollars, how diversified and stable our portfolio of revenue is. Do we have all our eggs in one basket? And if that one basket goes away, are we kind of stuck? We want to make sure that you're not looking at your organization that way. So that we'll have a lot of fun in that one as well. And then, of course, board governance, right? I mean, no organization can rise higher than the consciousness of its leadership, and the board represents that. And so we want to make sure that they're fully engaged, that you know how to work with them, and that they understand how to support you. So those would be the 4 pillars. Nikki, do you want to make comment about the other stuff on the curriculum?
Yeah, so in order to achieve this, the program has been broken up into 2 phases. The first is the first 4 months of the calendar year, and those are our large group sessions, the time in which we come together and you'll interact with each other, and we'll have our large group instruction. That's twice a month, the second and the fourth Tuesdays from January to April. We're about right in the middle of the day from 11:30 in the morning to 4:30, and our classes are held at the Stan State campus here in Stockton. So the second phase is really where you take what you've learned from the large group sessions and instruction and start to really work on the culminating project of this program, which is your sustainability plan. And so you'll be working on that. You can schedule office hours. We'll have work sessions. And so there'll be a lot of support and feedback during phase 2, resulting in a sustainability plan that you can implement, that's actionable, that takes everything you've learned and gets you going in a new direction towards sustainability. So with that, Jose, you want to cover some program expectations?
Yeah, absolutely. So you'll see that the program activity. So as Nikki mentioned, the first 4 months, January to April. So you'll have 2 sessions a month, and my colleague Christina will talk to you guys a little bit more of what it'll look like if you also decide to go through the Medi-Cal track, or what the Medi-Cal track will look like for you. But Nikki was clear, right? We're going to focus heavily on the development of your sustainability plan, and that's ultimately the culmination of the entire project. You're going to identify a minimum of 2 of the pillars that Kim was talking about earlier, and really just decide to, dive deep into those two pillars. What will these pillars do for your organization? How will it help drive your organization forward? And we're going to really just peel back a lot of the layers of your organization to make sure that you are setting not just yourself up, but your organization in a position to really be sustainable for the future. We've seen what this year has done alone with funding cuts, and our sector has been impacted by those cuts. How do we address those and anticipate things that might come our way? So one of the big pieces and that I really love about the program is the attention that you really get. As they mentioned earlier, there are office hours that we offer as a faculty, where you can meet with Kim or Nikki, myself, or anyone on the team to really just kind of talk things through, right? Where is your organization going? What are some of the things that are hindering it from really achieving some of the good work that you are set out to do? And how can we help you work through that? In addition to that, we offer one-off workshops. We'll bring in guest speakers. We have something called the Grit Series, which is almost like a subset of the capacity building program, which as a capacity building folks, you'll have early access to, right? For example, this month, Kristen's presenting on bad, good, and great boards and what it takes to really drive your organization forward with a strong board of directors. And if your board isn't strong, how do you then help them out of your organization, right? We don't want them stopping you from achieving your true work. Some additional benefits. One of the things that Nikki really hit on earlier that has been a major difference this year is tackling human resources, HR. We know HR can be, a nightmare for some folks, and we want to make sure that you guys are equipped with the right strategies, the right policies in your organization to ensure that you guys are protected as an employer. And then, of course, Kim does a wonderful job of diving into your budget. What does it look like? Where are you at? But my favorite is when she goes to your board meetings and stares your board members right in their eyes and asks them if they're really committed to your organization. And if they are, they'll let it be known. And if they're not, she'll be sure to call them out on it. That's Kim by far my favorite part of the program. So I look forward to being invited to those board meetings. But for the most part, as you can see, our expectation is to ensure that we set you up for success. Some of the pieces that where we hold you accountable is, program expectations continued here, your attendance. We want to make sure that when you decide to apply to this program, you're making a commitment that's pretty big, right? So we want to make sure that you're committed to attending the bi-monthly sessions. Again, this will look differently if you are going to also be doing the Medi-Cal track. We'll talk more about that shortly. There is a graduation requirement, which says that you must complete a sustainability plan. You will not graduate. We will not graduate you if you don't complete your sustainability plan, and you have to present it to your peers and a panel. And those are some of the big things that we really stress. We want to make sure that you are committed. And of course, the tuition commitment. As you can see here, based on your organization's budget, that's what tuition will be for your organization. For organizations who have an annual budget of over $1 million, you're looking at $1,200 per person, under $1 million, $600 per person, and full payment for anyone and everyone who's participating in the program is due before the first day of class. And we make sure that you have everything you need to get that taken care of in a timely manner. But one of the big pieces here, and I've already gotten emails about the determination process, right? This is something that we really honed in on the last, I think, year or two. And we wanted to be sure that we were working with nonprofits who were committed to really growing themselves and committed to holding themselves accountable. So you'll see some qualification requirements. You must have been in operation at a minimum of 3 years. I've already gotten some emails and phone calls. Well, I'm going to turn 3, or do I not meet it yet? I would still encourage you to apply. Right, you'll be able to we'll be able to see based off the strength of your application where you stand as an organization. You'll notice that the application is pretty in depth. We ask for a lot of detail from your org, but again, we're helping you get to where you need to go in order to be a self-sustaining organization, even through the application process. You must have your 501c3 status, must have an established board of directors, and your finance chair cannot be a family member, please. So let's just lay that out as we're having this conversation. We want to make sure that you are seeing yourselves as a growing business and organization. So hold yourselves to those standards, and we're trying to help you do that. And another big thing, and we've done, we've been more diligent about this the last couple of years, is making sure that, we are transparent with those who support you, your donors, and folks in the community. So we highly encourage you to begin working on your Charity Navigator or Guide Star ranking, which is now Candid. And of course, you must agree to the attendance commitment and the tuition commitment. So we'll get more into the weeds during the Q&A if you have anything specifically that you want to ask. But as you can see, you are committing to a lot. But again, you will get a lot out of the program. But I do actually now want to pivot over briefly to my colleague, Christina, who's going to actually talk to you guys a little bit about what the Medi-Cal process, or the Medi-Cal track will look like for the program. It'll be a subset of the capacity building program, and we'll talk to you about what that may look like in your application. But Christina, feel free to take the lead here.
Sure. Thank you so much, Jose. And, just to reiterate the determination, the requirements, expectations are all fairly consistent for the Medi-Cal track as well. We recognize that, entering Medi-Cal or, being involved has its own challenges. And so I really want to uplift the partnership between United Way's Alliance for Wellness, really our health initiative, and our partnership with Health Plan of San Joaquin / Mountain Valley Health Plan, who so generously funded our ability to administer the Medi-Cal track through their community reinvestment grant. So, the goal of this program is really to equip community-based nonprofits with the skills and knowledge essential to navigating the complexities of the healthcare system, improving patient care, and a big one, ensuring that compliance with Medi-Cal requirements. Again, it really is a huge undertaking, and we're here to not only support you, steward you through the process, but make sure that you walk away with some tangible tools to apply to your organization's operations and care coordination workflow. With that, next slide, please. So just to briefly review the curriculum, so just to level set with all of the agencies that participate, we'll do an introduction to Medi-Cal. It's an ever-evolving healthcare landscape. We want to make sure that you're getting the most current information, especially as policy is changing ever so rapidly. We'll go through, how to engage and empower clients. So do you have an outreach strategy in place? What does that look like? And making sure that all of that is teed up. And then really taking a deep dive within community care coordination, which is very different than how healthcare service delivery operates in a hospital or clinic setting. So, really honing in on that place-based care. Something, to really uplift is the closed loop referrals now per the Department of Healthcare Services. That is a mandate. So we'll be taking a deep dive, leveraging existing infrastructure across our county so that nonprofits have access to the technology that they need to satisfy that requirement. We'll also go through measuring health equity. So there are certain, metrics or data points that you should be capturing as per required through Medi-Cal. But even more, let's take it a step further. How are you leveraging this information, the impact that you're yielding through your program service delivery so that you can continue to expand your programs and attract additional resources, really taking it back to some of those NCBP pillars with the revenue diversification. How are you leveraging these Medi-Cal reimbursements to sustain your care coordination workforce? So if you have CHWs or case managers, but also sustaining programs, which we know when they're grant-based, sometimes those funds do sunset. So what is your plan then? Now that there are several transformations happening across healthcare with Prop 1 and the behavioral health transformation, really talking about what that service integration looks like, the pivotal role that CBOs play in connecting folks to care, that being behavioral health services, social care, and then of course supporting them in just primary care services as well. Two really big ones: navigating claims and billing. We heard our CBOs through our landscape assessment last summer that is a really big pain point. So we want to really provide an invoice template, uplift key data points that managed care plans are looking for on those invoices so that we can reduce denials and maximize, when you're getting those reimbursements. And then another key item is the quality improvement and compliance, and making sure that you're set up with policies and procedures, the appropriate workflows that are applicable to your organization so that services are being rendered compliantly, and where corrective action needs to happen, that you have a plan in place. So whenever there's that auditing process, or if you've already experiencing that auditing process, that we can help dovetail in any capacity. So the program phases are fairly similar, January through April. We have those bi-monthly sessions. Rather than Tuesdays, we're on Thursdays from 1 to 4 at Stan State. In addition to sort of that sustainability plan, and for us, it's really going to be how are you going to sustain your Medi-Cal programming, but again, walk away with some operational workflows, understanding how to properly invoice, and then policies and procedures that are very tailored to the managed care plans that operate in this county in particular. Again, you have staff support, whether you're participating in NCBP or just Medi-Cal or the combination. You have my support, and then the slew of subject matter experts that will be delivering these sessions. And what's required of you is really completion of the program. You will also be a part of the graduation process.
Excellent.
Next slide. Yeah, I think that might culminate. Mm-hmm.
Yeah, absolutely. It does culminate it all, but I do want to make sure. So we are in the important dates slide here. So we pretty much are kicking off the year by doing an info session today, meaning that on August 8th, this Friday, applications go live for the capacity building program. And we encourage you to get an early start on preparing everything you're going to need for the application. And our application window is going to close September 5th. But I do want to make a note. Christina, do you want to talk to them about what the process looks like for the Medi-Cal side?
Sure. So with the Medi-Cal side, please know in your application, your Medi-Cal track interest, being aware that there is limited capacity. That being said, for through the Alliance for Wellness, we have an RFA out for care coordination agencies that is closing on the 15th. To be eligible for a scholarship for the Medi-Cal track tuition, you must be an awardee and therefore apply to this RFA that is due on August 15th. So again, for scholarship consideration, you must be an awardee of the Alliance for Wellness. And then, of course, bringing to your attention that the Medi-Cal track is at limited capacity.
Thank you for sharing that. Yeah, so we go live, folks, on August 8th. We close September 5th. And in the general capacity building application, right below, once you enter your general information, you'll see, and you'll indicate whether you're interested in doing the capacity building program, just focused on that, on your 4 pillars, your 8 sessions. If you're going to be, applying for just the Medi-Cal track piece, noting that capacity building alumni will also kind of have a foot in just because they've been through the sustainability plan phase. So they'll just be able to apply for the Medi-Cal track only. However, if you are, as an organization, committed to doing both, there is an option to do the entire program, meaning that you are committing to 16 total sessions. The second and fourth Tuesdays, we encourage that your CEO or board chair be part of those. And then the second and fourth Thursdays, that should be program staff. We encourage program staff. So we'll be able to talk more through that process and what it looks like. But in the application, you'll indicate what your interest is. And then to Christina's point, there is an RFA open right now, and that is due August 15th. We were telling you all of this with the goal that we will be reviewing applications on a rolling basis, with December 11th being the first day of orientation. So more to come on that. That's where you pretty much get to meet your peers and who you're going to be, going on this 9-month journey with. So we're very excited to get you guys to that date. But as you can see, the large group session schedule is down at the bottom. Our capacity building program goes 11:30 to 4:30, while the Medi-Cal track will only go 1 to 4. But those are the dates that we'll be meeting at Stanislaus State. Again, I do want to emphasize, if you guys are interested in applying for both sides, we encourage executive director, CEO, or board chair or high-level directors to do our track, and then program staff to focus on the medical health side. So with that, Nikki, I'd like to turn it over to you briefly, if you can kind of give us some updates. We've talked so much about what this program can do, but like Nikki likes to say, it's nothing without data. So Nikki is our data whiz, and she'll tell you a little bit about the outcomes that we've found since the program has started.
Proof is in the data. That's right. Thank you, Jose. So I really think this is an important slide because this is feedback. This is data based on participant responses across several cohorts. And you might be asking yourself a question, looking at the attendance commitment, the tuition commitment, the commitment you're making for the culminating project. Is it worth it? Well, let's look at what past participants have said and how it has impacted their nonprofit and leadership. 95% of participants rated our program as highly effective for acquiring new skills and knowledge. Many of our participants had been enrolled in and completed other nonprofit leadership or training programs, and this was unique in the level of knowledge and skill acquisition that we're able to deliver. 90.5% of participants gained a deeper understanding of branding and community engagement strategies. This one just seems to really charge people and challenge to look at branding and the opportunity to engage community in a different way. This next data point of 89% was a snapshot in time and midway through cohort 2 of just when the in-class sessions were completed, not the full program of implementing their sustainability plans. But by the time they finished the 4 months of classes, 89% of the participants had already initiated changes in how their boards function to increase efficiency and effectiveness. And we really are able to do this through the content is not theoretical, it's very practical. And so Kim's way of approaching the development of the curriculum really equips leaders to do an assessment, analysis, and understand quickly what are some changes I can make. At the bottom of your screen, we have a couple of really great numbers, 100%. 100% of participants reported that by participating in the program, they experienced a change in the way that they approach problems and opportunities within their organizations. Just taking a different mindset. And you heard that from one of the testimonials in the graduation video. She sees things differently. She asked herself questions. Is this choice sustainable? Is this a wise decision for these 3 next steps that we're taking in the future? And 100% of participants believe that the program has effectively empowered them to increase the capacity of their organization. So that bigger global view of all of the pillars and teaching combined, yeah, I really feel that I have been equipped to increase the capacity. But a couple of greatest hits on the side there. 94% reported knowledge of nonprofit finance has been increased. 89% identified actions to improve financial health, and 72% approach their finances with more strategy. And that's done through the way that this content and curriculum is taught. It's not our info sessions online, but our large group classes are together in person. And it's a dialogue between the instructor and the participants, and participants with each other. So we give you an opportunity to learn, but then also chew on it, talk about tough situations that are relevant to the topic with cohort mates, and to talk about possible solutions and or bring in a subject matter expert. One thing that United Way does really well is tap into the leadership of the community, either by bringing in nonprofit capacity building program alumni, or nonprofit leaders within the community, or other subject matter experts to really help you answer questions, connect you to resources, but also to let you know that some of the challenges you may be facing as a nonprofit leader, you are not alone. We have found that other nonprofit leaders are facing those same things. And what this does is it creates a network and that you can rely on long after the program is over. So some of the data you don't see here that we do collect is how can we improve this program? And so over the course of 3 years, entering the 4th year into the program, we have been able to take the feedback each year and make the program stronger and stronger and stronger, yielding these high success rate numbers. So with that, I'll turn it back to you, Jose.
Thank you, Nikki. Really appreciate it. Yeah, we do our due diligence. You'll hear during one of the pillars where we talk about collecting data and the importance of it. We also try to make sure that we're finding ways to improve this program by hearing directly from you. So I'll keep it moving. I want to be mindful of everyone's time. This is a little testimonial from one of our cohort 3 participants. So really wonderful people. I won't stay too much on this slide, but as you can see, the program has really made a difference in how folks are approaching day-to-day operations in their nonprofit and what they're doing to really scale their organization. So we've pretty much come to the end of it, and I really want to give you guys an opportunity to ask questions and really kind of hear your thoughts as to maybe something that stood out during the presentation. There's 1 or 2 slides left, and it's just pretty much contact information and some application details, but I'll open it up for some Q&A. Anybody have any questions, comments that they would like to share? Please feel free to go ahead and just take yourself off of mute.
I have a couple questions. Hi, Jose.
Gary.
What's up? So obviously I've already completed the program, but I want to send a programmatic staff member to the Medi-Cal track. And my question is, can she do that and not also do the other track? Can she do that by herself? Maybe this is a question for Christina. Can she just go, even though
Yes.
I'm the one who did it?
The answer is
Yeah,
yes. Christina, take
Okay.
over.
Okay.
Yeah. So because your organization, a member of your organization, aka you, has completed the NCBP, you're welcome to do Medi-Cal track only and send that
Okay.
program staff over.
Okay, perfect. And then is it the same cost to do just the Medi-Cal track?
It is.
It is. Okay.
Absolutely.
That's my
And
only
then-
question.
Yeah. So at that point, Carrie, they're just committing to the 8 sessions for the Medi-Cal piece, and then
Okay.
be working with Christina's SMEs.
And I mean, it's okay if I support her, like, even if I'm not like attending the things, if I support her in putting together her plan and developing policies and all that on the back end. Okay.
Yeah,
'Cause I would plan to be,
collaboration is amazing.
yeah, I
Yeah.
really want to be like participatory and collaborative with her because she's pretty new to all of it. And so I would want to kind of be a part of it. Like, would it be okay if I popped in? Do I need to pay? I think there was something about like a visitor fee or something.
Yes, there's fees associated. For example,
Okay.
if you want to bring in like anyone who's not enrolled in the class, if they're coming in just to pop in for the day, but they're staying for the day, and things like that, the fee simply just covers like their lunch for the day.
Right. Okay, cool. Well, thanks, you guys. I have to run, but I appreciate you.
Carrie Grover, cohort 2 participant. Thank you so much, Carrie, for
Hey,
being here.
if you want a quick testimonial, I can give one.
Please.
Because I did really enjoy the program and felt like it was super helpful. And so if anybody's on the call and like wavering, I would say absolutely go for it. I found a lot of value in the program. The leaders and the teachers are fantastic. The hands-on, I can't say enough about how much I really did enjoy it. So I would say go for it.
Thank you, Carrie. Appreciate that.
Yeah.
Excellent. Anybody else have any questions or comments or anything you'd like to share with the group? Don't be shy now. This is your opportunity to ask away. But if not, if you are a little shy, which is totally fine, for more information regarding the program itself, so anything related to our, general application process or anything general to the program, feel free to reach out directly to me. Here's my email address along with my office number. Please feel free to just drop in my inbox, and I'll be more than happy to set aside some time to really meet with you one-on-one, even if we have to do it in person or even just over Zoom, to connect and answer any questions you may have. And then for anything related to the Medi-Cal track, please reach out to Christina, who's our expert in this area here.
Hey, I have a question. I'm not shy.
Okay, that's what I'm talking about. Thank you.
You're welcome. So if we have someone do the nonprofit capacity building program and someone do the Medi-Cal track, is that going to be $2,400 or $1,200?
That'll be
need to let the people who have the money know?
Yes, absolutely. So if you're committing to the whole thing, you're pretty much paying per participant. So at that point, if your organization's over $1 million, you'll be paying $1,200 per person. Yes.
Okay. Okay.
And
Awesome.
then just really quickly to note that dropped in the chat is a link to our landing page where you'll be able to access the RFA. Awardees have scholarship support to the Medi-Cal track.
Excellent. Thank you, Christina. And because you guys went ahead and just simply, took the time to, attend this session and really just made yourself available, we really appreciate your time. As we've said, right, we are going to be very intentional about the organizations who we allow in year 4. We're very excited to work with some wonderful organizations who are doing great work in the community. So with that said, we're giving you early access to the application. It is a lot that you'll have to start to gather, but if you scan the QR code here, it'll take you to the application itself, and you'll kind of see it's broken down into separate sections. You'll have a section for your CEO, a section for your board chair, and just general information regarding your organization. Again, please note at the very beginning of it, it does state on there whether you are committing to or applying just for the Medi-Cal track piece, just the capacity building side, or if you are going to be doing both. So that'll allow us to kind of really just, as we're reviewing applications as they come in, we'll be setting aside some time to really just, set up a meeting with you and you really just chat, get into your application and see where we can support. And then we want to be very intentional about how we're going through this process. So we'll be reviewing them on a rolling basis, just for your heads up.
Sweet thing. And it's on Google Forms. I just looked at it.
Yes.
Google Forms. Yeah. Okay. Cool.
Absolutely. So once you complete it, we'll be on the lookout, knowing that, we're giving you guys access to it already. But after today, we'll be on the lookout for it. So once you complete it and it's ready to go, expect the phone call or an email to set up a time to chat. We'll review it as a team and kind of go through that process. But yeah, we're very excited and more than anything grateful that you guys took the time out of your busy schedules to join us today. If you know any organizations who are interested or could benefit from a program like this, please, encourage them to apply. We do have a capacity building landing page on our United Way website where you can kind of hear more about the program, listen to testimonials, and kind of see the breakdown of the class sessions. Nikki, Christina, anything else you guys would like to add?
Just looking forward to everyone's application.
Yeah, absolutely. Any other questions from the group before we disconnect for the evening? Awesome. Well, thank you all so very much. We look forward to seeing your applications come in. Look forward to continuing to build relationships with you. If you have any questions, again, don't hesitate to reach out to myself or Christina, and we're here to support. You guys have a wonderful evening.